In Greek mythology, Medusa was a dreaded creature of fear that petrified people with her gaze. However, it is less known that in her history, Medusa is also a symbol of new life. The powers of her blood were said to have succeeded in bringing a dead person back to life. This is why a highly promising research project bears her name today: Medical Education in Surgical Aneurysm Clipping, or MEDUSA for short. The aim of MEDUSA is to develop a simulator for neurosurgeons to train complex brain aneurysm surgeries. An aneurysm is a pathological bulge in a blood vessel. If an aneurysm remains untreated, it can rupture and lead to life-threatening bleeding. For the surgical treatment of complex aneurysms, the skull has to be opened, and the aneurysm has to be treated with a clip. These clipping operations are particularly challenging, as even the smallest mistake can have serious consequences for the patient's life. As aneurysms can increasingly be treated endovascularly, that is, with minimal intervention via the groin, it becomes more and more difficult for surgeons to gain experience in aneurysm clipping.
In MEDUSA, we have the possibility to perform real simulations of a highly complex neurosurgical procedure. As a surgeon, I have the possibility to train different clipping strategies the day before the surgery starts. In this way, we can increase patient safety as well as treatment quality.
The MEDUSA research project builds exactly on this idea. MEDUSA is a simulator for neurosurgeons that enables them to train all the steps of a clipping surgery in a safe environment. Not only approximately, but exactly on an artificial twin of the patient.
The MEDUSA system is a mixed reality simulation platform for cerebral aneurysm surgery. For aneurysm surgery, the exposure is key. The exposure to the aneurysm and proper clipping of the aneurysm without rupture and without ischemic damage.
Using medical image data, MEDUSA calculates a virtual representation of the brain. The surgeon can view this through a microscope while performing the simulated operation using real surgical instruments.
In the MEDUSA platform, you can simulate the procedure the day before. Not any procedure, but the patient that you're gonna do surgery on tomorrow, tomorrow's patient. And by doing so, you learn about all the anatomical features of the individual anatomy of this patient. And you can take all this into account to reduce surgical morbidity the day after.
MEDUSA also offers didactically prepared content to optimize the training and education of future surgeons. In addition to educational materials, simulation examples and interactive elements are available. The Department of Neurosurgery at the Medical Faculty of the Johannes Kepler University and the Kepler University Hospital in Linz is one of the leading specialist neurosurgical clinics in Europe. This expertise serves as the basis for the MEDUSA research project and is to be anchored in the medical simulator in order to create the best possible prerequisites for physicians and patients. The vision of MEDUSA is to establish a cooperation platform with a focus on medical simulation and thus promote cooperation in Upper Austria. In this way, technologies can be developed that will be incorporated into future medical products, such as surgical planning and simulation systems. The MEDUSA research project emerged from the Medical Technology Lead Project, which was tendered by the province of Upper Austria. 7 research institutions and 6 companies from Upper Austria are involved in its implementation. A project like this is only as strong as each individual supporter. Special thanks go to all those who believed in our vision and research. We would like to thank our funding providers, who have not only contributed financially, but also with their commitment and trust in our team. Your partnership has helped us to achieve our goals and push the limits of medical education. Together, we are shaping the future of medicine.